Welcome everybody to Lessons from the Field. This is a series where we welcome a diverse array of guests who have a common thread, a passion for pharmacy and pharmaceutical sciences. And today we're featuring Allison Blackmer, who is a 2008 graduate from our PharmD program, and somebody I remember well because she was in classes that I taught. And I definitely look forward to talking to her again in this interview. Allison is associate professor at the Skaggs School of Pharmacy and Pharmaceutical Sciences at the University of Colorado on their medical campus. And like the other interviews that I've done, we'll be asking the guests, in this case, Dr. Blackmer, a series of questions. From those questions, we'll gain some insight from her on her career and experience and some advice that she might have for our students, alumni, and friends. So Allison, it's great to see you again. Like I said, I remember you well from when you were a student here, and I've valued being able to watch your career over the years since you've graduated. And you recently got an award. I think, was it Preceptor of the Year? Or yeah, and congratulations on that.
Thank you.
It's really, for faculty members, as I'm sure you know now, it's really gratifying when you see former students go out and do great things, and you're definitely one of those.
Thanks.
So Allison, maybe we could start if you could just give us a brief overview of your time since you left UIC, a little bit about your career and what you've done.
Absolutely. First, just thanks so much for the opportunity to speak with you today. It's really nice to see your face again and to have the opportunity to share some of my experiences. So thank you. So I graduated in 2008 from UIC, and afterwards I pursued 2 years of residency training at the University of North Carolina. So I did my first year as a general PGY1 resident there, and then ended up specializing in pediatrics for my second year. I was pretty torn between specializing in critical care and pediatrics, and ultimately decided that if I just combined the two, I didn't need to decide between critical care and pediatrics. So ultimately chose pediatrics with a critical care focus. Once I graduated from the University of North Carolina in 2010, I took my first faculty position at the University of Michigan in Ann Arbor, where I had a split faculty position at the school and then at the Mott Children's Hospital, where I specialized in pediatric surgery. So there I took care of pediatric patients in the pediatric intensive care unit, the neonatal intensive care unit, as well as on the floors, all of who had surgical issues or trauma. And then, let's see, in 2014, I made the leap and came to the University of Colorado, where I also have a split position. My distribution's a bit different than it was at the University of Michigan. Here, I'm sort of a 50-50 split between the School of Pharmacy as well as Children's Hospital Colorado. And I'm now in an outpatient clinic called the Special Care Clinic, which is a primary care for pediatric patients with high special needs or complex conditions. So I see lots of kids with rare congenital disorders, or sort of a whole host of a combination of problems that require a more complex care. So I'm just coming up on 6 years here at the University of Colorado, and have been really grateful to be here, and the experiences leading me up to this point.
So in the short time that you've, since you left, you've crisscrossed the country. You've been to 4 great colleges of pharmacy. And so I'm sure you've seen a lot of great pharmacy practice and interacted with people along the way, whether preceptors in your residency or colleagues or advisors or mentors or supervisors in the different positions. So maybe you could tell us, for our students and alumni who are listening, a little bit about those experiences and some of the people maybe, or events or situations that have influenced you the most or informed your career as you moved along.
Yeah, absolutely. So When I came to the University of Illinois in 2004, I actually was on the path to get a dual PharmD PhD program, and thought I always knew I wanted to pursue academia, and honestly didn't know that much about clinical pharmacy. And so really was thinking that I was going to pursue a PhD in medicinal chemistry. But very quickly within the curriculum, I was exposed to clinical pharmacy and amazing faculty and preceptors that really opened my eyes to what was possible. And I quickly realized that I could stay within academia, but have clinical impact in the hospital and outpatient settings, and sort of changed my course within my second year of school. UIC really exposed me to all of these opportunities and continued to afford me the chances to continue to pursue those. I always think back to UIC as sort of giving me the foundation and the inspiration that I needed to then continue forward. So I'm very grateful to the education that I had at UIC. At UNC, North Carolina, I continued to be able to work with amazing preceptors and individuals who I saw role model the types of activities that I hoped to accomplish at some point in my career, ranging from teaching to maintaining a high clinical practice and then performing research. These were things that I thought, like, maybe in 10 years or 15 years I'll be able to do. When I went to the University of Michigan, I was really fortunate to work with a surgeon by the name of Daniel Teitelbaum, who unfortunately has passed away, but he was a huge influence on my career very early on. And he sort of took me under his wing and believed in me to do things that I thought would come much later for me very early on, and sort of said, here's this grant, you should apply for it, just do it. And not knowing anything about applying for grants or any of that kind of stuff, having someone just have the confidence and the experience to say, you can do this and I believe in you. And here I was thinking I was this like new fresh grad, had no idea what I was doing, and he was encouraging me to apply for federal funding and things like that. So I really, there's a lot of figures along the way, but Dan Teitelbaum, I think when I was first starting my career as my first big girl job with no preceptors behind me, really said, you can do this and you have the abilities to do it. But had I not had that and the foundations for my education and training, I don't think I would have been able to really see that future in front of me.
Yeah, it's amazing how much influence individuals can have, and great mentors, and you know it when you see them. I think we all have examples of that. So thanks for laying that.
Yeah.
The next question I was going to ask you is, you're in a very specialized area, pediatric critical care and special populations. The science continues to change and practice changes, and I think we all struggle a little bit with how to stay up on that, how to stay relevant. You're not that far out of school and still fairly fresh in your career, but I'm sure that even in your situation, you've experienced that. Is there advice that you have on how to continue to expand your knowledge or experience, or to stay relevant, especially for our recent graduates who are in that kind of a position?
Yeah, I think, all of our jobs, mine included, sort of demand that you stay relevant and up to date. And I always think about this. And for me, I think, the first thing is being able to recognize and admit that we will always have something to learn, and be willing to be vulnerable and admit that we don't know something, or ask questions, and then really being willing to seek the answers for that. I've got sort of two categories on how I stay relevant. The first is from my students actually asking me questions. And, I could teach something that I've thought, this is something I've taught 5, 6, 7 times, whatever, however many times, and a student will ask a question in a way that hasn't previously been asked. And it really makes me think, and that that challenges me to think beyond what I have previously known or ways in which I've suggested it before. So taking students on rotation and teaching them in the classroom is really one of the keys, I think, to staying up to date, because they're always 3 steps ahead of where I am. Similarly, my patients and their families really sort of demand that I stay up to date. I think the nature of the patient population that I take care of, given that most of them have rare disorders, many of which I've not heard of before, I very quickly have to find the information about their disease state and then figure out how to treat them. So that's sort of the more global thing. More tangibly, I subscribe to a lot of table of contents of journals and have sort of trained my brain to look through the table of contents and kind of remember articles that, like, oh, that's a good one, I need to come back to, or I download them into sort of a to be read folder, which really helps. I also subscribe to updates from the FDA, which keeps me up to date on new drug approvals or biologics and things like that. And then just continuing to seek professional opportunities at national conferences, board certification, things like that, sort of forces you to stay up to date. But
Yeah.
It's not easy with the change. I mean, it changes so quickly. And yeah, I mean, the example I always give my students is I remember learning lipid management as a student, and it was like, at that time it was so black and white and it was never going to be clearer than it was, and these were the targets, and now we don't even shoot for those targets. So
yeah, that just
yeah.
shows you how important it is to keep going and stay up to date. That's great advice, though. I think anyone who's in academia would relate to the student example, and how our students really keep us motivated and on our feet. And I think also the patient example is a great one. I mean, I think all pharmacists, wherever you work, have, experienced that, where you get questions and you're basically forced to, and it sounds like you're very organized and thorough like you do. So congratulations. I think that's very helpful information. I think we kind of already covered this next question, but I'll ask you again, anyone, in case there's anything more you want to add. But you talked about your time at UIC and how that influenced you. Is there any other advice you might want to give to students, or anything else you can relay from your time at UIC on how that helped you prepare for your career?
Yeah, the education that UIC gave to me was incredibly comprehensive and really covered all aspects of pharmacy practice, ranging from pharmaceutical care to pathophysiology to therapeutics and everything in between. And I think because of the specialty I'm in, I use all of those things on a daily basis. And so having that sort of ability to see things as a whole, and really critically think my way through complex situations, I think spans back to the way the curriculum was set up at the time that I was a student. I'm not sure if the PDAT series still exists, but I loved how we learned everything sort of as a whole piece, the pathophysiology, the therapeutics, all as one module. And that's sort of how my brain has continued to think about things. I think the other thing was just the number of opportunities available at UIC, from electives in the classroom to required courses, and then the number of API rotations to choose from. I really feel like it helped open up a lot of doors and exposed me to aspects of pharmacy practice that I previously would never have thought of, A, existed, or B, that I was capable of doing. So I think, advice for students is just to take advantage of all those opportunities. And it's very much like the more you put into the education, the more you'll ultimately get out of it. And I know that sounds cheesy, but I really think that's true. And if you want an opportunity, if you turn the corner and ask for it, my guess is that it's there. So, yeah.
Well, thank you for that. I'm sure I'll relay that back to our faculty and all the kind words that you said about the program. But you mentioned some advice for our students there, which I think is really good. But maybe turning that around, I know you had this mentor, Dr. Teitelbaum in Michigan, or maybe there's others who gave you advice along the way. Is there anything that sticks in your mind as really key, something that you've remembered or that you really think is important to pass on to other people?
There's sort of two pieces of advice that I've heard. One was from my husband, actually, who's not in medicine at all, but he always has encouraged me to open as many doors as possible. And that way I can choose which one I want to walk through rather than sort of narrowing my opportunities too early on. And that means a lot of different things to a lot of different people, but I think just being open to, you know, a number of different possibilities and being flexible really ends up, then you have a choice and you've not sort of pigeonholed yourself into one direction. So I really think about that a lot, and I tell my students that that's what I'm like, don't narrow your options too early because you just never know what's around the corner. The other piece of advice is sort of an opposite approach, I would say. When I was graduating residency, almost everybody I talked to would say, you know, you're going to need to learn how to say no. You're going to learn to need to say no. And although that is true, and I tend to say yes to too many things, I turn that around and think, instead of learning to say no, which to me sounds more like closed off and you're closing off opportunities, is to really learn how to say yes, and sort of how to prioritize and think through the yeses rather than the nos. And I'm still trying to figure that out for myself. I'm not sure I've mastered that yet. I'll probably spend my whole life trying to figure that out. But again, it kind of goes along this sense of trying to find as many opportunities as you can, and being open to those things and not being confined to what you think you can do, or, you know, barriers perceived or real, but deciding, you know, I think I might want to do this later on. How can I get there? And kind of going with it.
Yeah, no, that's great advice. I mean, I totally relate to the being open and flexible. I'll also advise students, especially, to not, you know, narrow their options early. But learning how to say yes is a great one. That's something that, you know, takes, I think, a lot of maturity too, because you have to really think about, well, what can I commit to if I do say yes, and how do I limit it to something that's really practical or doable? So excellent advice. So the next question is kind of along the same lines, but maybe venturing outside of just the professional or work life to life in general, or balancing your career and your home life. Do you have any advice or tips for especially young alumni who are, you know, trying to develop their career and be successful like you, but also, you know, want to balance their life in general and have time at home and so forth?
Yeah, I mean, that's a really important thing. And I'll be the first to admit that I don't always, well, I didn't, it's better now, but when I first started off, my lines between work and my non-work life were pretty blurred, if at all existent. And I've really been working hard over the last several years to figure out a way to have a better balance. And again, this is not something that I claim to have mastered. So maybe I'll try to listen to my own advice here too. But I have found that it is important to have some downtime, and that means something different to everybody. You know, for some people that means an hour a day, and for other people that means they don't work at home on the evenings and the weekends. And there's no right and wrong answer to that. But I think finding whatever balance works for you as an individual and allowing your brain some downtime actually makes you find better clarity when you're at work than trying to push through 24 hours a day with no time to sort of let your brain rest. when we moved to Colorado, I told my husband that we needed to get a hobby, and he thought that was a really funny thing because you don't just like get a hobby. You have to have an interest or a skill or something. And so I took that as a challenge that I thought we could just get a hobby. And we have successfully found new hobbies because I was really committed to this. And it's really been helpful to have something that sort of takes me away from, the day-to-day and the pressures that come with any one of our jobs. So it's still a work in progress for me, but I'm now on a curling team,
Wow.
which is kind of interesting. And I garden, and just those times allow me the time to sort of decompress
Yeah.
and find the clarity. So
Yeah. Well, that's great.
and yeah, old habits die hard though. So the sooner you can learn this,
The sooner you can learn how to curl, the better.
yeah, exactly.
Curling is not the first thing I would think of as a hobby, but
No.
I think, any sport or hobby where you really, to me, if you really have to concentrate on it and it takes you away from everything else, and that can refresh you. So,
Yeah.
wow, and you're in a great place to have hobbies. I think Colorado with all of the outdoor opportunities that you have. So
It certainly does.
yeah. Well, this has been a lot of fun, Allison.
Yeah.
As we wrap this up, if you have any last words of advice for our current students or young pharmacists, alums who have graduated recently, or your former classmates, anybody out there who might be listening?
Yeah. Gosh, I don't know that I'm really, the one that should be giving advice here, but I would say, like, don't accept the status quo, and really think about ways that we can continue to evolve and change this profession. So the profession is made up of the people inside of it. And if we think of this as not a job and as more of a profession, we can shape what we want the future to look like. Just like your education, I would say this profession is very much like the more you put into it, the more you'll get out of it, and the more it continues to give back to you. Some things that you think might be these small opportunities very early on circle back and open up so many additional things and chances. And the chance to come back and speak with you today is one example of that. So I think it's just very much, finding ways to continue to invest in yourself and in the profession, and it will invest back into you.
All right. Well, thank you, Allison. It's obvious why you've done so well. You obviously have a great head on your shoulder and great advice for all of us, even those of us who are well along in our careers.
Thank you so much. I
Good
really
luck with
appreciate it.
semester coming up and everything. And
Thank you. You too. Nice
All
to
right.
talk with you as well.